Well, she's known as the fastest woman in the world, but thyroid disease nearly stopped Olympic medalist Gail. She will join us live after 12:25 to tell us how she fought back and what you should know about thyroid disease.
Fighting thyroid disease is what's hot today. It affects 27 million Americans. Half of those people don't even know it.
Thyroid gland controls every cell, tissue, and organ in our body. So if it isn't functioning properly, neither are you. No one knows that better. Gold medalist Gail. She joins us today along with Dr. Jeffrey Garber. Good afternoon.
Good afternoon.
Good afternoon.
Gail, you are a world-class athlete. How do you deal with a health problem like this? I mean, you spent your life just getting in shape, and then something like this comes along.
It was traumatic. I mean, to be honest, it was back in 1988 when I first started having my symptoms, and like you said, I was on top of the world, ready, primed for the Olympic Games, and the bottom fell out. I started experiencing dry hair, brittle nails, weight loss. I mean, extreme weight loss, where at my worst I was under 80 pounds. I had large eyes, they were bulging out, I had the goiter, I was constantly tired, and there were no answers. I went through a series of doctors, and nobody could give me a proper diagnosis, mainly because a lot of these symptoms are so common that everybody or anyone can complain of having, being tired or gaining weight. So it was really hard to put that diagnosis together because it could be misconstrued to be stress, or you're a top athlete, you're in great shape, you're just stressed out because you're trying to peak for the Olympic Games. And I was very fortunate that a chance meeting with the UCLA team physician actually said, hey, I think there's something wrong with your thyroid. I think you should get a TSH, thyroid stimulating hormone, very simple blood test. Diagnosed me. I take now medication, 1 pill a day for the rest of my life, and I was able to go on and pursue the Olympic dreams that I have. And what I've been told from my doctors is it's about being precise, it's consistency, and I'm very vigilant when it comes to that, to the point that what I call act thyroid smart. When my doctors say that there's something wrong, they say get the test that they tell me to get, I get it. I check it to make sure that refill is what it's supposed to be, and then I go back and I test myself with a TSH from my doctor frequently. And so there's just a lot of wealth of information that we want to tell people that
yes,
powerprevention.com, go on it, educate yourself, and get your life back on track also.
Dr. Garber, real quickly, who is at most risk for falling victim to thyroid disease?
Principally women. Some statistics say 80% of those with over and underactive thyroids are women, particularly also those from family with thyroid disease, autoimmune diseases. Those are the categories of disease where the body attacks organ systems and organs. Those, for example, type 1 diabetes, rheumatoid arthritis, and lupus are examples of those illnesses. So family history, particularly of thyroid disease, women.
All right, thank you both for joining us this afternoon. Some powerful information that you supplied us with. We appreciate it.
Thank you for having us.
Thank you.
Thanks again.